Hello, and thank you for joining us on KHOU 11+. I'm Sherman Chow. Since we first entered 2025, we brought you some helpful tips for better living with our Health Matters pieces. Now we want to revisit those, starting with clever ways to get in your workouts without a gym membership.
We can't all be gym rats. So, for the rest of us, orthopedic surgeon James Showery has some ideas.
A couple of different exercises, things you can do around the house without any equipment. You know, everybody wants to have great calves, and I gotta say the calf raises might help a little bit. Most of that's genetic. If you have a standing desk or you're waiting in line, just coming up on your heels, you know, standing straight up like that.
Simple enough, something you can do almost anywhere, like during that office meeting. Next, for those quads, wall squats.
And you just gotta slide down so your knees are about a 90-degree position, pushing up against the wall. You can hold this for as long as you can. That'll work, and you really feel a burn on the inside of your thighs.
Okay. So say while you're brewing a cup of coffee, you can squeeze in a few reps.
What are you doing?
I'm awakening.
For the more advanced version, a standing squat.
And what you do is just kind of come straight down, driving your knees out, right? Keeping your chest up, coming to this position, holding this position, creating stability in this position.
Batman never skips leg day.
Batman never skips leg day.
And neither should we. 5-minute break at your desk can build strength and balance. Don't judge me. Next, the bird dog pose with a yoga mat or rug.
You want to get a mat or on a rug or anything in your house. What you do is you want to get on all fours, you know, so you're kind of square, knees right over your hips, hands in front of you, and then one leg back, and then one arm up. And you want to hold this for anywhere, 10, 15, 30 seconds.
This is more of an at-home move, while you're keeping an eye on something else.
I call these my Netflix poses. Multitasking.
Another good exercise for your core, the side plank.
Going on your elbow, where you prop up right here and you just hold your hip up above the ground, staying on your elbow.
Jesus, I'd give you the 25 grand as a signing bonus.
Well, that's harder than it looks.
No pain, no gain.
January was Cervical Cancer Awareness Month. Nearly all cases are caused by infections with the human papillomavirus, but there are ways the disease can be prevented and cured. Here is Stephanie Simmons.
In 6th grade, while many preteen boys and girls are focused on their hobbies and friends, Juliana Montalegre is thinking about her health.
At my age, you can get an HPV vaccine, so if you get that chance, you just have to take it because it would be a lot worse if you didn't.
At just 12 years old, Juliana recently attended a cervical cancer summit and is now leading the way to help raise awareness about the human papillomavirus and how getting the vaccine can help prevent it.
When I got it, I was like, it's just a normal vaccine, but I didn't realize how much it could help.
The HPV vaccine is the first immunization we have against cancer. It's incredibly important for young women especially. And the best window of opportunity is for both boys and girls between the ages of 11 and 12 years old.
The intent of that age is to give the vaccine prior to a boy or girl's sexual debut. So before their body has encountered HPV or the human papillomavirus, we want to prepare their bodies to be able to fight it off so that they never see that infection to begin with.
Gynecologists Dr. Georgina Amaral and Dr. Caitlin Hanley are both advocates of the HPV vaccine and offer insight for those with concerns.
We have a proven track record for both safety and efficacy for this vaccine.
This vaccine actually prevents cancer. It has at least an 85% efficacy in preventing cervical cancer and has the potential to eradicate this cancer.
The HPV vaccine is focused on 9 strains. Depending on your age and situation, it's a series of shots ranging from 1 to 3 doses spaced roughly 6 to 12 months apart. And as this brave girl will tell you, a little sting is worth the reward.
When I got it, it kind of hurt, but like the next day it hurt more. But
just like a regular vaccine.
Yeah.
HPV or human papillomavirus is nearly ubiquitous. 80% of men and women will be infected with at least one strain at least once within their lifetime. And most of the time, our bodies can fight off this infection, just like any other virus. But if it persists, that can lead to precancerous changes in the cells of the cervix, which can then lead to cervical cancer.
These doctors with an important message that such a prevalent virus can be thwarted for boys and girls with a simple poke.
Anytime you've been to the doctor, one of the first things they do is check your blood pressure. But experts say you should be doing this regularly. Ron Trevino explains.
All right, put that on and okay.
You want to have your blood pressure checked. You may ask yourself, is there a doctor in the house? Or in this case, the studio?
Then what I'm going to do is I'm going to pump up the pressure.
Dr. John Higgins, a sports cardiologist with UT Physicians.
Have you found a pulse yet?
Yeah, I think there's a heart in there.
Turns out my blood pressure is pretty good.
Excellent, 125/85. So that's great, right? That's a good blood.
I've got that going for me.
Yes, you definitely have got that going for you, which is good.
So why is it so critical that you get it checked?
Knowing that there's some problem going on before the breakdown occurs with your body, like blood pressure, can be really, really important for people to know, not only so they are aware that there is a potential down the line for a problem, but also they may be able to mitigate the effect and or correct that so that they don't run into those problems down the line.
Most of us get our blood pressure checked first thing at a doctor or dentist office. But what if you know you have high blood pressure and need to have it checked more regularly? There are devices you can buy for that, commonly sold in drugstores.
The best ones are going to be the ones that you do actually, at the upper arm and at the brachial artery. And you just essentially wrap the cuff onto the arm, which is exposed, and then you just push a button.
Here are some tips from Dr. Higgins. Sit down and relax for a few minutes first. Wrap the cuff around your non-dominant arm. The arm needs to be relaxed and resting on a surface like a couch or table, and your legs should be uncrossed.
Preferably, we don't want you to have anything to eat or drink right before it, because again, salt in the food and other things may affect your blood pressure.
Checking blood pressure could save your life, and if you suffer from high blood pressure, Dr. Higgins says often diet and exercise are all it takes to bring it down. But as always, ask your doctor.
In 2010, Congress declared February National Teen Dating Violence Awareness and Prevention Month. One pediatrician tells us what parents need to be aware of and why sometimes an uncomfortable conversation is important. Rekha Mudraj explains.
As a mother of a teen, a tween, and a toddler, I'll be having the talk at least 3 times. But Dr. Monica Arango, a pediatrician with UT Physicians, says there's a related conversation more parents like myself need to have with our children about dating violence.
But it sounds like the sooner the better you have this conversation, the better it is for families.
So it's very important that these teenagers started learning what is a healthy relationship, how can I put boundaries on these situations.
Dr. Arango says dating violence is about control. It can be experienced at any age and can happen across all socioeconomic and religious demographics. But one tool has exacerbated the problem among teens and tweens.
Technology facilitated abuse. They are looking for them. They are seeing where they are at, who you are at with, what kind of posts do you put online, who are your friends, what are you doing right now, why you haven't called me.
Dr. Arango says emotional abuse can quickly escalate to physical abuse.
Somebody throwing your phone, throwing a paper, or throwing something to you, or maybe just like holding your hand very strong.
How do I explain the concept of consent to my daughter?
You can give consent to hold hands, but it doesn't mean that you're gonna kiss. Or you move over and you say, okay, is that okay? Then you have a consent and you give the other person the permission to do another approach with you.
Dr. Arango says signs your child may be in a troubled relationship include having trouble in school, a major change in their attitude, especially toward activities they like, major mood swings or overreactions, or needing to be on the phone constantly to respond to a dating partner. Another sign includes changes to their appearance.
I always put sleeves up. Go up here, because I want to see some kind of like a cell-cutting markers. I want to see bruises. I want to see some of these things.
Dr. Arango says parents should try their best when it comes to setting a good example for their children and model healthy relationships that emphasize good communication. She says if parents are in a tough situation, showing their children how to resolve issues and leave toxic situations can also help break the cycle of domestic violence.
Sleep is something we all do, but many of us don't get nearly enough of it. And it turns out that can lead to some serious health issues. Trayson Bragg explains.
Lively and bubbly grandmother Lachelle Ivory says she's always been active.
I like being outside, playing with my grandchildren. I have two, and for years I was a martial artist.
But she tells me for years all of her favorite hobbies were bookended by naps.
I was very lethargic during the day, very fatigued. I had always taken what my family calls Lachelle naps.
Lachelle's sister urged her to see Dr. Rakshanda Majid with UT Physicians.
Lachelle's sleep apnea was, even to me, surprisingly more severe than what I was expecting.
It turns out even though Lachelle was spending 7 hours in the bed, she wasn't getting a good night's sleep. Dr. Majid says that's a common problem.
And what that means is for an individual, they can't focus during the day, they have demonstrate low productivity, they are grumpy, short-tempered, they can't focus.
And it turns out there are serious health effects as well.
It increases our risk of heart disease. It increases our risk of high blood pressure, diabetes. Not getting enough sleep increases our appetite and increases our risk of developing obesity.
So what is getting enough sleep? Dr. Majid says for adults that's defined as 7 hours of consistent, uninterrupted sleep. And that's exactly what Lachelle gets these days, thanks to her new sleep apnea machine.
So what are the signs that you may need to see a specialist? According to Dr. Majid, if you're getting 7 hours of sleep and still don't feel like yourself, are tired, find yourself falling asleep behind the wheel, or you're having difficulty completing a simple task like sending an email, well, you may be suffering from a sleep disorder. If you have kids, there may be a chance that they are active in the world of sports, but balancing competition and safety can be tough, which is why experts want you to know about the different dangers associated with concussions. Rekha Mudaraj again here with details.
Football is king in Texas, but kids here love sports of all kinds. 16-year-old Maddox Joy, a sophomore at Friendswood High School, plays football and basketball, but an injury on the hardwood earlier this year set him back.
I dove on the floor for basketball and got kneed in the back of my head and kicked in the front of my head and kneed on this side of the head.
I mean, he continued to play, so I thought he was fine, and then when he started kind of wobbling and looking for the trash can, you know, he got nauseated. That's when we kind of realized what was going on.
His mother, Amber, knew what was happening and got Maddox medical attention immediately.
The sooner an athlete's removed from play and interventions are implemented, the better the outcome.
Dr. Summer Ott, a sports neuropsychologist, helped treat Maddox.
No two concussions are ever alike, which makes this job very interesting. And even with athletes that have came back and maybe they've had a second concussion, many times the symptoms can look different from the first ones.
Physical symptoms include a headache, dizziness, trouble with balance, feeling like you're in a fog, or having trouble concentrating. Emotional changes can happen as well and include feeling stressed, anxious, or depressed. Maddox's recovery involved rest, physical therapy, doctor's appointments to check his progress, and patience.
They have to limit a lot of the electronics devices, and yeah, no TV time. So it's a long process. And keeping your kid off of the phone is difficult enough.
It was a drill familiar to the Joy family. Maddox had suffered a concussion once before.
My first reaction was like, no more sports, you know, jokingly, obviously, because I know my son wants to play, and he loves and thrives in that.
But Dr. Ott says all parents must consider the risks of playing sports.
We want patients to live fully and have, you know, prosperous lives after this. But I do have those conversations is important because there can be long-term consequences.
Maddox is on track to make a full recovery, and he's excited to get back on the court and the field.
Thank you so much for watching this special right here on KHOU 11+. For more stories like these and other important health information, head to khou.com/healthmatters, where you can see our latest health reports.